Hello, lovely viewers. Welcome to Globe TV. This is Globe Lifestyle. On today's episode, we'll be discussing mental health. We have a mental health specialist in our midst who will be helping us. But before that, before I introduce my guest, let's go for a quick commercial break. We'll be right back. Hello, sir. Welcome to Globe TV.
Hi, nice to be here.
Thanks for coming.
Welcome.
Okay, so you go by the name Isaac Tuffuor.
Yeah, that's correct. My name is Dr. Isaac Tuffour.
Okay.
Yeah.
So if I'm to ask, who is Dr. Isaac Tuffuor?
Okay. Um, Currently, I'm based in the United Kingdom. Um, at the moment, I work at the University of Wolverhampton as a senior lecturer there at the Department of Faculty of Health, Education and Wellbeing. Apart from working in academia, I also work in various clinical settings throughout the United Kingdom.
Okay, that's not that's really nice. Okay, to start with our program, today's topic, mental health. If from a layman's view, what is mental illness?
That's a very good question. I think before I will answer the question. We need to consider what is mental health. Um, so the World Health Organization defines mental health as a state of well-being in which an individual is able to realize his or her own potentials and can cope with normal life stresses, and then also can work productively, and then also be able to contribute to his or her own community. Um, this definition is a bit problematic because if you look at a country like Ghana, um, because of endemic poverty, unemployment, housing problems, and everything like that, people are not able to achieve their full potentials. In fact, I believe that the unemployment rate in Ghana maybe, don't quote me, but it could be more than 50%. So here is a case where probably more than 50% of our graduates are not able to achieve their full potentials, and maybe they are not able to contribute meaningfully to their own community. So does it mean that they have mental illness or no? So does it mean that they don't have mental health? So that's a problem here. Um, so this definition of mental health by the World Health Organization is not helpful in that sense. So simply put, mental illness could be defined as all health conditions involving maybe changes in their thinking, emotions, and behaviors.
Okay, okay. So, sir, please, what are there types of mental illness? Do we have types of mental illness?
Yeah, of course, yeah, sure. There are loads of hundreds of different mental illnesses. However, to make this informative for our viewers, let's try to simplify this. Mental health in general um, can be classified under seven main disorders.
Okay.
So we have, for example, mood disorders, and under this maybe depression and bipolar affective disorder may come under this. And then also we have anxiety disorders, where people may tend to have excessive fears, worries without any. This can also be classified as a mental illness. And then also we have psychotic disorders, where there are changes in the person's perceptual thinking, like they could be hearing voices, seeing things people don't see, or maybe smelling things people can't smell, and all sorts of things. And then also we have personality disorders, and under this there are a lot of um, um, diagnoses that come under this. And I think the most popular one would be maybe narcissistic personality disorder. Um, and then also moving on, there is also eating disorders where people may person may be experiencing eating problems, issues. And then also, there may be also um, uh, trauma disorders. So, by the person being exposed to traumatic experiences, may also experience mental illness. And then also, there is also alcohol and drug disorders. So, people who may be abusing drugs and alcohol may also experience mental illness as a result. So, all these come under this umbrella of disorders. So it's a bigger, yeah, it's a very, very broad area.
Okay. Can you identify some of the symptoms of mental illness to us? I don't know if you can generalize one and then we talk about it, or I don't know if they are all the same too. The symptoms of mental illness.
So like I said, mental illness is changes in person behavior and way of thinking and then emotions. So for example, you may sort of observe that maybe your loved one, your friend, suddenly may be having some behavior changes, which is odd, which you can't really understand. And maybe their way of thinking could also be odd as well. Suddenly they become suspicious, paranoid, avoiding people and all sorts of things. Or maybe you have a person who is possibly emotionally resilient, suddenly becomes very tearful and cannot cope with normal things which they used to cope well in the past. So all these could be signs and symptoms of mental illness. But having said that, I hasten to add that you don't necessarily jump into conclusion that the person has got mental illness because they are experiencing these symptoms which I mentioned. So people may be stressed at work, and maybe after a few days they don't feel stressed again. They may have low mood, and after a few days they don't feel low mood anymore. So you cannot necessarily jump into conclusion that the person has got mental illness. All right. So for a person to be diagnosed with a mental illness, these symptoms or some of these symptoms should be sustained for a long period of time, possibly weeks or months, before you can finally conclude that the person has got certain mental illness.
Okay, so we know some of the symptoms of mental illness. What are some of the causes too? What causes mental illness in us? Like, what causes them?
That one is very tricky question.
Sure.
Up to now, there's no one cause of mental illness. So there are so many various causes of mental illness. So, for example, some have some scientists or some psychiatrists have concluded that maybe mental illness is maybe biological or hereditary factor. So, for example, studies have shown that if one or both of your parents do experience mental illness, there's more likelihood that you will also get psychological factors. So when people are maybe exposed to certain traumatic experience as an adverse effect, maybe they may experience mental illness as well. And then also some studies have also shown that it could also be as a result of a chemical imbalances in the brain. So, for example, there's a certain chemical in the brain called serotonin. This is known to have this feel-good effect on the person. So, with serotonin, you feel happy, euphoric, and everything like that. So, if there's an imbalance in this, maybe that could also cause a mental illness as well. And then also traumatic experience, as I said. So there are a lot of causes of mental illness. So in short, mental illness usually, we say it's caused by biopsychosocial factors. So biological factors, meaning maybe if your parents you're likely to experience that. And then also as a result of psychological factors, being exposed to trauma, psychological issues, abuse, maybe stress at work, and all sorts of things will also cause that. And then also social factors. Even studies have shown that people who live in certain communities are more likely to predispose to mental illness as well.
Okay.
So there's no one factor to
Yeah, maybe.
causing mental illness. A lot of them.
Okay. Viewers, I hope you are enjoying the show. We'll be right back after this commercial break. Hello, lovely viewers. Welcome back. A very big thank you to our sponsors, JM Ado and Sons Limited, importers of virgin olive oil, 1 plus 400, alpha garlic, and others. And also to New Global Pharmaceuticals, manufacturers of Eviglow and then Paraglow. We have Global Production House and Event Management. Before we continue the program, let's take a quick motivational message from Kweku Costley. We'll be right back. We continue the program here with Dr. Isaac Tuffuor. Doctor, please, what are some of the treatments for mental illness?
Okay, thank you. So basically, mental illness can be treated with two main sort of two different ways. The first one is medication, and then the other one is psychological intervention. So, for example, we have lots of psychotropic medications, um, including antipsychotic medications, antidepressant medications, and then also mood disorders. So, depending on the person's diagnosis, these sort of medication could be helpful. And then, in addition to that, there's also psychological therapies, which could also be helpful for to treat mental illness. So, for example, evidence have shown that a person experiencing mild to moderate depressive symptoms, maybe the first line of treatment could be psychological intervention rather than maybe medication. So there are so many different ways of treating mental illness, and usually it could be a combination of psychological intervention and then also medication.
Okay, so doctor, how can one cope with someone with mental illness?
That's a very good question, and I think first of all, it's never easy to live with a person experiencing mental illness, but then studies have shown that we are all predisposed to mental illness, so we are more likely to also experience mental illness. Sometimes, we believe, for example, in Ghana here, person with mental illness is the person only walking on the street naked and then talking to himself or something. But like I said earlier on, maybe common stresses, common simple mood problems, or mental illness. So, in order to cope with a person experiencing mental illness, we need to be empathetic. We need to put ourselves in the person's shoes. We need to be compassionate. To understand the person. So without having this basic understanding, basic human values, then we will not be able to cope with a person experiencing mental illness. So we have to be compassionate and understanding. And then also sometimes people tend to sort of underestimate, undervalue the symptoms the person is experiencing. So we need to believe the person experiencing those symptoms. Let's not let us know, say, oh,
That.
just get over it, this is just no.
Yeah.
So once we have that, we are dismissing the person, and they may shut down, and then their symptoms may worsen. So we need to be human. Very, very important.
Okay, doctor, before you continue the show, some of our viewers have sent us some messages. And then we have this one from Mr. Daniel Usamponsa. He said he's enjoying the show. So to his question, how can I speak to or ask anyone for help when I have a mental problem like depression or anxiety?
Yeah, because of stigma, people tend to not to talk about mental illness, and it's something that we need to educate people so that people can freely talk about mental illness. Mental illness is not something you can see, unlike a broken leg or broken hand. It's something that you feel within you. And so to be able to seek help, maybe you need to get a confidant, somebody you trust, so that you talk to them and then tell them how you're feeling, the changes you are going through. And then maybe they may be able to pinpoint you to the right directions. Or maybe talk to your doctor, your general practitioner, before the symptoms become worse.
Okay, there's one too from Prince Boedu. He's asking, what do I do if it is an emergency like suicide or depression?
Um, that's a very, very good question. In my clinical career, I've dealt with so many people who are suicidal, and it can be very, very difficult experience for the person supporting the one with suicidal ideation, as well as the person themselves. So anytime you have any suicidal tendencies, the first thing that you need to do is pick up the phone or talk to somebody you trust, and then seek assurance from them, and then let them take you to a place of safety. It's very, very important. Sometimes because of taboo and culture and everything like that, we tend to believe that talking about suicidal ideation is not something you should be talking about. But actually, it's very, very important. When you're feeling suicidal, you have to verbalize it. Talk to someone and declare. Don't bottle it up. Talk to someone to clear it from your mind.
So opening up to others are very important in these situations.
It can be very, very helpful.
Okay. So let us continue. I want to ask if there are specific medications to mental illness.
Well, so for example, if you're talking about, let's say, somebody with a depression, okay, the best medication maybe, let's say, if it has transpired that maybe they are not experiencing mild depressive symptoms, but maybe moderate to severe. So then some medication could be antidepressants. There are so many different types of antidepressants, and I don't think this is the right time to go through them. So, for example, there are so many different types of antidepressants to help treating the treatment of depression. And then also for somebody experiencing mood disorders, there are also a lot of medication to help stabilize the person's mood. And then also there are a lot of antipsychotic medications to help the person experiencing psychotic symptoms.
Okay. I think we talk about this. What are the compassionate ways of a person suffering from mental illness? That's when you said you can open up. If you don't have to do those
stigmatize the person. Yeah.
So which means we've answered this question. You just have to bring them in and then talk to them.
Yeah.
Right.
Absolutely. And I've heard a lot of stories in Ghana here where it is alleged that when a family member is suffering from mental illness, maybe they drive him far away and then dump them there so that they cannot trace their way back home. And I think this is a criminal act, I believe, and it shouldn't, it should be criminalized, because if you can't treat your own loved one with love and compassion, then what sort of human being are you? So, I mean, to support a person with mental illness, like I said earlier on, we need to be compassionate. We need to be understanding. We need to put ourselves in the person's shoes and ask ourselves, I could be the person experiencing this illness.
Yeah.
So if I was a person experiencing, is that how I want to be treated? These are very, very important things that we need to be asking ourselves.
Okay. Okay. Let's take some of the questions here. We have a question from Moffat. He's also asking, are there drugs or therapy better for mental health conditions? That's when he talked about the antidepressants.
Yeah, so first of all, we cannot
Go
talk.
into that.
No, I mean mental illness or mental health problems. No, we cannot just put them under sort of one umbrella. So there are so many different types of mental illnesses. So we need to first of all establish the diagnosis before we can then make a decision which medication will be helpful.
Oh,
So if, like I said earlier on, if the person is experiencing the depressive symptoms, then obviously antidepressants will be helpful. If it's maybe psychotic disorders, then maybe antipsychotic medication will be helpful. And then if it's mood disorders, maybe mood stabilizers will be helpful. So first of all, there are so many different types of mental illnesses, and we need to establish the diagnosis
for each of them.
before we start thinking about treatment.
Okay. Viewers, we hope you are enjoying the show. We'll be right back. Welcome back. We have one question from Sewakutu. She's asking, I feel quite slow sometimes. Should I see a therapist?
That's a very good question. It depends on how often she does feel low, and then when she's feeling low, how long does it last?
Okay.
So if it's sustainable for a long period of time, then chances are that maybe there may be something there
There
that
might be
maybe
a
she needs to talk
problem.
to someone.
Yeah.
But however, if she's feeling low and is able to brush it aside and then move on with her life, then that's fine. And I don't think there's any need for her to panic.
Okay. So I hope your question has been answered. Thus, I have one last question for you. How stressful is your job?
Um, yes, it can be very, very stressful. So the sort of job I do, I'm always on the front line, dealing with people who are acutely unwell, who are suicidal, and then also making threats to take their life, and then self-harm and all sorts of things. So it can be very, very stressful to deal with such people. However, the most important bit, the most rewarding part of the job is helping somebody to come out of distress and then for them to cope with normal life. That's very, very stressful and rewarding.
Okay. And I want to ask this. This one is from me. What advice will you give to the youth? Because we, the youth of these days, this we suffer mental illness a lot. We take things to heart a whole lot. What advice will you give to us?
I think the best advice is take life easy, live healthy lifestyle, avoid using drugs and alcohol, and then also do more exercise, healthy living, you know, and then sort of maybe checking your weight and all sorts of things. So these are very important factors to avoid, to live healthy mental health.
Okay. Have you been attacked by someone during your line of duty?
Um, Not personally, but I've suffered a lot of verbal abuse from my patients or service users. However, one thing that we need to know is there's a misconception out there that people experiencing mental illness are more likely to lash out and beat people and kill people or something. That's not true. People with mental illness, they are more likely to harm themselves than to harm the others. So we need to put this out there to educate people that um, people who are experiencing mental illness are not violent in general. However, we need to also understand that, okay, if somebody is experiencing mental illness and then also they are under the influence of alcohol or drugs, then of course, their way of thinking and behavior will change and they are more likely to lash out. So we need to be careful here. So in doing my job or in doing this, you have to always constantly do risk assessment and see, understand, is this person risky? Are they likely to lash out? How is their mental state at the moment? These are very, very important things to consider.
Okay. Viewers, I hope you've enjoyed today's show. Doctor, thank you very much for coming. We've really learned a lot. Thank you very much, viewers. We hope you enjoyed today's show and then you really learned a lot. Thank you for sending your questions. A very big thank you to our sponsors, News Global Pharmaceuticals, manufacturers of Ibuglo, Power Glow. In case of any body pain, you can contact them. And also to J. Amado and Sons Farmers Limited, importers of Borges Olive Oil, One Plus 400, Alpha Garlic and others. And also to Global Production House and Events Management. Thank you very much for watching. Bye-bye.